This presentation will be about health promotion targeting diabetes mellitus in the Aboriginal and Torres Strait Islander population in a remote area. We would like to begin this presentation by formally acknowledging the traditional owners of the land on which we meet today, the Darug peoples, and we would also like to pay our respects to the elders past and present. Hello and welcome to our presentation. In today's video, we will be focusing on Aboriginal and Torres Strait Islander health promotion. My name is Nerissa, and I am joined by Sakina and Kuldeep. Today, we will be delving into the most significant health aspects that affect Aboriginal and Torres Strait Islander people, and we will be primarily focusing on groups who live in a remote community with low health literacy and a high prevalence of diabetes mellitus. Our presentation will include the aims and objectives, which will explore the link between culture and health for Aboriginal and Torres Strait Islander people, presented by myself. I will explore the significance of culture and land and how it influences health for Aboriginal and Torres Strait Islander people, their traditional medicines, and their approach to healthcare today. The social determinants of health is to be touched on by Sakina, who will provide an in-depth explanation of education, socio-economic status, and health issues in relation to our chosen health issue of diabetes mellitus. Kuldeep will then explore how we as nurses can tailor culturally competent care to patients with an Aboriginal or Torres Strait Islander background and link this to remote communities with low health literacy and high prevalence of diabetes mellitus. It is no secret that culture is the main pillar for all ways of life for the Aboriginal and Torres Strait Islander people, and this includes significantly their health. Health for Aboriginal and Torres Strait Islander people is not just a physical description, but is a balance of emotional, cultural, and social well-being of not just the individual, but collectively of the community. And this holistic life view is the basis of Aboriginal and Torres Strait Islander spirituality and connectedness. The land is what provides harmony and well-being for the community. It encompasses mind, body, and spirit. And without this connection to country, the Aboriginal and Torres Strait Islander people consider themselves to be lacking health and well-being. These communities tend to maintain better self-assessed health when they recognise their strong attachment to their culture. The strong emphasis on the spiritual connection to land and value of native title influences the way that Aboriginal and Torres Strait Islanders understand and interpret health and illness, and the way they seek out healthcare services when experiencing a health issue. For example, they may seek out a traditional healer who uses resources from the land rather than a doctor in a healthcare setting for a given health issue. This image depicts the notion that well-being, which is the Aboriginal concept of health, is the central pillar which all other aspects of life for Aboriginal and Torres Strait Islander revolves around. Before the emergence of modern medicine, Aboriginal and Torres Strait Islander people relied on traditional medicine and remedies for prevention and cure of illnesses with resources derived from the land. Instead of doctors, they had traditional healers, known as the Gainkaris. There is a need for this traditional medicine to be immersed into westernized medical practices so that the two can exist together and offer optimum care for Aboriginal and Torres Strait Islander patients. A common practice of traditional medicine is the use of bark as a splint for broken bones, and this shows how deeply rooted culture and land is to Aboriginal and Torres Strait Islander people and their health. An example of the blending of Aboriginal health into modern health is the establishment of the Aboriginal Community-Controlled Aboriginal Health Services, also known as the ACCHS, which is a health service developed in order to allow Aboriginal and Torres Strait Islander people to experience a holistic style of healthcare. This program is essential to Aboriginal and Torres Strait Islander self-determination, as it allows these people to have a voice in their care and consider their culture and values in every health decision that they make. According to a decade-long study which focused on Aboriginal and Torres Strait Islander connection to culture in Central Australian remote communities, lower mortality rates were demonstrated among groups with strong connection to culture, land, and family. In communities where traditional language and community were maintained, residents have a lower likelihood of diabetes compared to other Aboriginal and Torres Strait Islanders across the Northern Territory. Diabetes, also known as diabetes mellitus, is a life-threatening disease marked by high levels of glucose in the blood and is a common illness affecting Aboriginal and Torres Strait Islander communities. Despite the plethora of research demonstrating the positive connection between health and a strong relationship with culture, it doesn't shadow the fact that Aboriginal and Torres Strait Islander people are still 3 times more likely to develop diabetes mellitus compared to non-Aboriginal and Torres Strait Islander people, particularly in remote areas, with 21% of residents with diabetes. This can be pinpointed to lack of health literacy and lower accessibility to health services due to their location. Aboriginal and Torres Strait Islander people are 5 times more likely to be hospitalised for conditions that could have been treated by primary healthcare services, and this is especially apparent in remote communities where access to healthcare is limited. High turnover of staff in these centres creates difficulty for Aboriginal and Torres Strait Islander people to maintain lasting relationships with health professionals. In turn, higher mortality rates are apparent in remote communities, with Aboriginal and Torres Strait Islander people reluctant to seek out health care. Aboriginal and Torres Strait Islander people also feel reluctant to seek healthcare services due to prior experience with culturally incompetent care from healthcare staff, who present discriminative and racial behaviour, and statistics show that they only presented to healthcare centres when symptoms of disease have become severe. Kuldeep will touch more on this issue later in our presentation on how we as nurses can deliver a culturally competent and safe nursing practice to our Aboriginal and Torres Strait Islander patients. Essentially, the link between culture and health for Aboriginal and Torres Strait Islander people is strongly intertwined with the connection to the land and the holistic worldview which these communities strongly value. Studies have shown that stronger connection to land improve Aboriginal and Torres Strait Islander health. However, health literacy and lack of resources allow diabetes mellitus to persist amongst these communities. Sakina will now talk to us about the social determinants of health, which will relate back to our chosen health issue of diabetes mellitus.
Social determinants of health consist of several factors. These factors include social support networks, social environment, gender and culture, healthy child development, biological characteristics, personal health practices, and coping skills. For Aboriginal and Torres Strait Islanders living in remote areas, the social determinants of health relevant to diabetes mellitus are education, socio-economic status, and access to healthcare resources. In remote areas, the Aboriginal and Torres Strait Islanders often experience lack of education. When they are diagnosed with a health issue like diabetes mellitus, they do not recognize the severity of the disease. Therefore, they keep this information to themselves and don't discuss the situation with other people, including a healthcare professional. This has been supported by a health worker who stated that the family member of diabetic patient don't want the community members to know about the health issue because they want to avoid the criticism as having a health issue has negative stigma attached to it. In addition, the visit to the doctor's office may not be as effective because the lack of familiarity with complex medical terminology used by the doctor to explain their health condition. But if they had the advantage of having sufficient access to efficient education, they wouldn't feel ashamed or have low self-esteem about understanding the doctors and would visit the doctors more often. They would have been more confident and able to control and improve their health and status and lead a successful life. This has been proven by a health worker who states that a lot of people feel that they do not have a lot of control over their health because they feel they might not have education and understanding, so they feel like they do not have control over it. Also, it is stated by a patient that she has diabetes mellitus and has never been explained anything about the disease, nor had any information provided, which left her very scared and concerned about her health condition. But when she went to the doctor several times, she understood what it was and received support. This shows that these people need simple approach and relatively longer period to understand their situation. In remote areas, the Aboriginal and Torres Strait Islander belongs to a lower socioeconomic class. They have limited access to fresh food, and transport are victims of poverty, unemployment, and are low-income earners. For diabetes mellitus patients, it is very important to have a healthy diet, but due to the socio-economic condition, it is very hard for them to afford fresh food because it is expensive, and they are required to travel a long distance to buy their grocery, which would add to their expending. Thus, people in remote areas prefer fast food since it is cheaper and easily accessible. Whelan, 2017 stated that fast food, which is poor in nutrition, is cheaper and easily accessible, especially in remote areas, but the supply of healthy food is limited and expensive. This is proven by the health worker, who stated that the Aboriginal and Torres Strait Islanders are often not in control of the food brought in their house. In the presence of large number of children, the fresh food and healthy supply of food, especially fruits, are not feasible. Moreover, transport is another big issue in remote areas, especially for the people who have health issues like diabetes. A patient who has diabetes mellitus stated that when she goes for her appointment to do her test, she has to catch a bus at 5 a.m. to a major center while she is fasting and come back home at 5 p.m. This shows that just for a test, they have to sacrifice their whole day while being consistently concerned for their children. Also with the low income, they cannot get the treatment that they need, and they cannot purchase their medication. But if they had the average income, they might receive a better treatment and live a healthy life. Lilly, cited in Spurling 2017, stated that you give a man a job, he can afford housing. He will no doubt want to look after himself, and he then changes himself as a role model for his children. The health in that is massive. This shows that if the Aboriginal and Torres Strait Islander people have a job and receive a better income, it will improve their socio-economic status and improve their health. Additionally, in remote areas, the Aboriginal and Torres Strait Islander people might not have access to health services. Even if there are health services, it is always remotely located. However, if they want to attend a healthcare service, they have to travel long distance with no certainty to receive the information that they required. War 2013 states that discussing health issues with non-Indigenous health professionals is a difficult task for diabetic patients because they feel a lack of trust with their healthcare provider due to cultural differences and social distances. Some health services do not deliver same medical need to the Indigenous client as they did to the non-Indigenous clients. Reported by Paradise. Australian Institute of Health and Welfare reported in War 2013 that for the Indigenous people, it is very difficult to access the services because of long waiting hours, difficulties with the cost of the healthcare, transport, transport expenditure, and unavailability of the service at the time of need. Therefore, the Aboriginal and Torres Strait Islander people are disadvantaged with regards to having access to the adequate health resources. Kuldeep will now going to present the application of cultural safety nursing practice.
I will talk about how nurses can provide safe and cultural competent care for Aboriginal people in remote areas. As we discussed above, that diverticulitis type 2 has been highly prevalent in Australia among Aboriginal and Torres Strait Islander communities in remote and very remote areas. Burwin Wright in 2016 clearly stated that high blood glucose levels can damage the heart, blood vessels, eyes, kidneys, and nerves, resulting in permanent disability and premature death. High risk factors, hereditary, poor lifestyle, cause mortality and morbidity in Aboriginal people living in a remote area. So government has started various health programs such as primary health care settings in a remote area, and nurse is key person to provide a safe and cultural competent nursing care at different healthcare settings. Firstly, I'm going to define cultural competency. According to Darnell and Hickson in 2015, cultural competency refers to the healthcare workers to work effectively with cultural context of person, family, and community. Health knowledge and health-based care is provided in a sensitive, creative, and meaningful way to improve the way of life and to meet the health care needs of Aboriginal and Torres Strait Islander people. And now I'm going to discuss the importance of cultural competent care. It is important to improve the access of healthcare services for Aboriginal people to address diabetes as well as improve the disparities in health outcome. According to Freeman et al. In 2014, suggests that this will encourage the Aboriginal community's active participation for early detection of diabetes, its risk factors, self-determination, management, prevention, which further decrease the incidence of diabetes. Nurses should have cultural awareness, cultural skills, knowledge, and cultural encounter which provide a safe and cultural competent care to Aboriginal communities in remote area. Freeman et al. In 2014 clearly stated that experience of cultural respect should be in nursing practices to make sure that the service is welcoming with greetings and should be based on social view of health as well as access and availability to be universal for all regional communities. Nurses need to show respect for cultural differences, cultural rights, practices, values, and expectations of Aboriginal people by establishing safe environment. Nurses should focus on a holistic approach to interact the people towards the healthcare services. Nurses need to develop leadership qualities to lead the organization that shows a respect for needs and priorities of indigenous people by maintaining culture within agency for clinical innovation. Equity should be maintained within nursing practices to develop consultation and engagement with Aboriginal communities to ensure the health literacy programs, policy design, and the delivery of health education materials. Cultural respect training can enhance the capability to deliver cultural sensitive and respectful health services. Use of appropriate communication techniques in nursing practices that develops the ability to understand the health issue and healthcare needs in Aboriginal people, and this also develops the trust and rapport with healthcare professionals. Effective communication ensures the patient safety and maintain the patient-centered care, which foster the decision-making of Aboriginal people in their healthcare plans. Appropriate communication in nursing practices prevent social, cultural, and language barriers and enhance the ability to grasp the important health information in clear manner. Nurses should use the verbal communication such as pay full attention while making conversation with Aboriginal people and listen them carefully, and if health information is in written, then it should be in correct language, clear, understandable, and legible. Non-verbal communication involves facial expressions, gestures, eye contact, head movements, which enhance the quality of patient-centered care, and establish the faith to make the correct assessment and facilitate the relevant interventions, and also helps to gain the insight into socio-cultural outcomes. Nurses need to maintain therapeutic interpersonal relationships with Aboriginal people and make sure that all Aboriginal people afford the accessible, affordable, and equitable health services in developed primary healthcare settings in remote areas. Cultural protocols refers as ethical principles which guide the behavior in particular situation. These are designed to protect the cultural and intellectual property rights of Aboriginal and Torres Strait Islanders. These also give us a way to improve the working relationship between healthcare personnel and Aboriginal and Torres Strait Islander people. Cultural protocols should be designed in nursing practice to guide public, private, and organization to effectively engage, communicate, and to do work with Aboriginal communities. Nurses should accept that it is not possible to change the people's value and beliefs as you think it is right. Nurses should be open-minded while treat Aboriginal people with decency and respect. Nurses need to show respect to Aboriginal people through traditional welcome and welcome to the country. Nurses should not show any discrimination or disparity while providing healthcare services at different settings in a remote area. If the nurses will not aware and good knowledge about Aboriginals' culture, background, beliefs and rights, socioeconomic status and their lifestyle, then nurses will not be able to develop effective communication and safe cultural competent care, and this will cause insecurity and useless insight among Aboriginal people towards the healthcare services. Aboriginal communities will not show interest in the participation in diagnosis, risk factors, self-determination, management, prevention, and health education with chronic conditions such as diabetes mellitus. Consequences will show the increased incidence and the risk of chronic illness instead of minimizing the impact of progression of disease and ill health complications in Aboriginal communities. In brief, nurses should have a good knowledge, awareness, practice strategies and cultural skills and protocols for working in remote areas, especially for care of Aboriginal and Torres Strait Islander. This will help the Aboriginal communities to come forward and show their interest in participation in healthcare delivery system within their cultural perspective. Cultural competent-based care will help the Aboriginal communities to prevent chronic disease, protect their physical, mental, social well-being, and promotion of health via health education. Finally, it can be concluded that we choose the most important health aspect which influences the Aboriginal and the Torres Strait Islander people's health, and primarily put the emphasis on Aboriginal and Torres Strait Islanders people living in remote area who have lack of knowledge regarding good health maintenance and responsible factors for highly prevalent chronic disease such as diabetes mellitus. We involve the aim and objectives that explores the link between culture and health for Torres Strait Islander people. We explore the significance of culture and the land and as well known that how this influenced the health of Aboriginal people, medicines and their approach to healthcare. We also focus on the social determinants of health, which involves the lack of education, access to health services, and the poor socioeconomic status. For instance, food, transport, and income are limited in a remote area. This shows the difficulty for Aboriginal and Torres Strait Islander people to get treatment for health issues such as diabetes mellitus. Then we represent the role of nurse to provide the safe and competent care within their cultural prospect, which involves dealing with respect and how nurse can develop good working condition in partnership with Aboriginal and Torres Strait Islanders, appropriate use of a communication with verbal and non-verbal communication and cultural protocols. So the nurse is key person to upbring their health status by providing adequate health education and awareness as well as a good quality of healthcare services in primary healthcare settings. With this knowledge, we can decrease the incidence of adoptees and improve the health outcome of Aboriginal and Torres Strait Islander people in a remote area.
Thank you for viewing our presentation.